My name is May Estiva. I'm a breast clinical nurse specialist in Northmead Hospital under Royal Free London Group. This video will tell you about the things you can do to prevent and reduce osteoporosis. Osteoporosis is a condition that weakens or thins your bones. Your bones will become more fragile and easy to break. Not everyone will develop osteoporosis following breast cancer treatment, but the risk is significantly high. Other risk factors include age, gender, and lifestyle.
Osteoporosis can develop as a result of various factors and is affected by older age, being female, lifestyles such as smoking, poor diet, and lack of exercise, hormonal changes, and treatments for certain diseases. If you've had breast cancer and are now on hormone-blocking medication such as letrozole, anastrozole, or exemestane, you may have heard that these drugs can weaken your bones over time. This happens because estrogen, which normally helps keep bones strong, is reduced by these treatments. Women on these medications are at a higher risk of developing osteoporosis, a condition that makes bones more fragile and more likely to break. But there's plenty you can do to help keep your bones strong, and in this video, we're here to help you understand how.
My name is Trisha Mitchell-Edwards. I am a breast cancer nurse practitioner and I work at the Royal Free Hampstead. There is lots we can do to reduce the risk of osteoporosis. Osteoporosis affects all of us. As we become older and we enter menopause, most women can develop osteoporosis because of the reduction of estrogen in our body. Now, we would always say diet and exercise are the two key factors that can support bone health.
Osteoporosis is often called silent disease. In the early stages, you might not notice any symptoms, but as the condition advances, bones becomes weaker. You know your bones becomes weaker when you start losing your balance.
Common symptoms include back pain from fractured or collapsed vertebrae, loss of height over time, and a stooped posture. Fracture can occur more easily.
There are tests available for osteoporosis, such as bone density scan. Bone density scan is a painless scan that is run by X-ray beam to detect strength and weakness of the bones. You're more likely to have a bone density test if you're on hormone therapy, over 50, or have other risk factors. There are treatments available for osteoporosis. Your doctor might suggest medication to protect bones. This can also reduce the risk of breast cancer returning in the bones. However, there is a lot people can do for themselves to reduce their risk.
There are treatments available for osteoporosis. Your GP may recommend that you take calcium and vitamin D, or you may actually have to take a bisphosphonate or a bone strengthening drug.
Managing osteoporosis involves a combination of medications, supplements, and lifestyle adjustments. Medicines such as bisphosphonates and hormone therapy can help strengthen bones. Supplements such as calcium and vitamin D are also important. Your healthcare professional can advise you on what you might need. The following lifestyle changes can make a real difference to your bones. Incorporate healthy habits into your daily routine, such as eating a balanced diet, exercise regularly, and use supportive footwear to prevent falls. Make your home safer to prevent falls and keep up activities that improve your balance. Maintain a healthy weight. Stop smoking, as smoking can weaken bones and increase the risk of fractures and osteoporosis. Avoid excessive alcohol consumption, and move more. You should try and avoid sitting around for long periods. If you find you've been sitting for a long time, get up and take a stroll. Regular exercise is essential. Exercises that gently stretch your joints or strengthen your muscles, such as walking, jogging, yoga, or Pilates, help strengthen bones. Try weight-bearing exercises like brisk walking, dancing, yoga, or climbing the stairs. as these can help stimulate bone growth. Strength training, which includes lifting weights or doing exercises with resistance bands, helps build muscle, which supports your bones. Lifting a bottle of water or a tin of soup also works.
When doing exercise, we recommend you do weight-bearing resistance training. That may include running, jogging, using bands where you can get muscle strengthening, or simply doing a brisk walk. The Royal Osteoporosis Society has a very comprehensive website that you can actually use.
Exercise is one of the best things you can do for your bones. Even 20 to 30 minutes a day can make a difference. But remember, always check with your doctor or clinical nurse specialist before starting something new, especially after surgery or treatment.
I was diagnosed with lobular breast cancer just at the start of the lockdown in March 2020. My treatment was to have a simple mastectomy without reconstruction, and then hormone tablets. My advice to people would be to seek help places like Maggie's Centres, Macmillan, and from other cancer patients, because they have walked the walk. So if you can build a little tribe around you of people that have already done that, that can really help. So I'm lucky, I was told that my bone health was good, but I really want to keep that as I go through menopause. So what I've done, and what I would encourage anybody to do, two things: I lift weights safely, and I do what's called weight-bearing exercise. So I stay on my feet, I walk a lot, I run, and I use a skipping rope. If you're not sure about how to lift weights, find somebody called a cancer exercise specialist, because they're personal trainers who have been trained specifically on how to do weight training after cancer.
A diet rich in calcium and vitamin D is essential for good bone health. Foods such as milk, cheese, yogurt, cereals, oily fish, eggs, and mushrooms are key for bone health. You can find calcium in tofu, fortified plant milks, and leafy greens like kale. After cancer treatment, you may need more calcium and vitamin D. Your doctor, dietitian, or nurse specialist will help to advise you on how much you need and if you need any supplements.
By taking these steps, you can help prevent and reduce the risk of osteoporosis, ensuring stronger bones and a healthier future. Looking after your bone doesn't have to be complicated. Small steps can make a big difference. Eat well, stay active, get enough vitamin D, and don't be afraid to ask questions. Your GP, breast care nurse, or oncology team are there to support you. You've already come through so much. This is one more way to look after yourselves for the future. To conclude, there are effective treatment and lifestyle changes that can significantly improve bone health. Always stay connected with healthcare team. And finally, there are resources available to help stay strong and healthy. Thank you for watching.